So we've heard the term narcissism, narcissistic personality disorder. It's kind of a buzz diagnosis that's thrown out around a lot in society. Oh, I'm dating a narcissist, or my ex was a narcissist, or maybe I've been told I have narcissistic personality disorder. So in this video, we are actually going to break down what is narcissistic personality disorder. My name is Gabriel Arroyo. I'm a licensed marriage and family therapist located in Southern California. If you're new to the channel, welcome. I'm super happy to have you here. Be sure to subscribe to stay up to date with our weekly videos on mental health related topics and helpful coping skills for you to apply in your own everyday lives. So you've heard the term and the diagnosis of narcissistic personality disorder. We're familiar with it. We see it in media. We've heard it in our social groups. Maybe we've been accused of being narcissistic. But what does that actually mean? It's not just you're overly confident or that you're confident in general. Sometimes people use the terms inappropriately. So now we're going to break down what the actual diagnosis is and what does it mean to have it. So narcissistic personality disorder is a pattern of this type of behavior. And in order for somebody like myself, a trained professional or marriage family therapist, a psychologist, anybody working in mental health, in order to diagnose this, we are following the symptoms outlined by the DSM, Diagnostical and Statistical Manual of Mental Disorders. And there are 5 out of 9 of the symptom criteria that needs to be met in order to meet criteria for narcissistic personality disorder. Now, that is important because what I don't want to happen is people watch this video and they're like, oh my God, I date a narcissist, right? Or, yeah, I'm going to diagnose that you have or I have narcissistic personality disorder. By all means, that's not what this video is for. It's just informational. And by all means, if you feel that that is the case, please seek professional help to get an official diagnosis and evaluation to rule that out or determine if that's the case. Ultimately, if you're questioning it and you're kind of concerned that you may have that, you're probably not, because as you'll see with the criteria that I'm about to outline, that's typically not the case. So it's 5 out of 9 of these symptoms. So the first symptom is grandiose belief or logic for yourself. So I'm grandiose. I think I'm amazing. Everything I do is infallible, and I'm just the most amazing human being in the world. So grandiose belief. And then criteria number 2 is that preoccupation with fantasies of unlimited success and just being amazing. So 1 and 2 really go hand in hand. The third one is that we're believing we are special, right? We're unique. We are God's gift, and we are, once again, these amazing, infallible human beings. Number 4 is the excessive need for admiration. Like, I constantly need that praise. I want my ego stroked. And then number 5 is a sense of entitlement. I'm demanding and have these unrealistic expectations or unreasonable expectations. So now that's 5 right there. So if we're ticking all 5 of those just from the get-go, remember the criteria is 5 out of 9. So let's break down what those 5 really mean. So the grandiose belief of I'm amazing, I can do great things, overly confident beyond my abilities. So if I thought I was the best therapist and I can help absolutely everyone no matter what because I'm the best, that would be grandiosity and grandiose beliefs of myself. I'm overly confident beyond my actual means and capabilities. And then number 2 being the preoccupied fantasies of success, unlimited power. So I'm constantly striving for that and really believe I can obtain that. Number 3, believing that I am special and I should only be associated with other people kind of on my level. So hence the shirt, right? It's just a joke shirt, right? My wife bought it for me. We think it's hilarious because it's Disney, right? But no signs of intelligent life anywhere. So it's me thinking that I'm that superior that I can't associate with anybody else because no one else is on my level. And then number 4, that required constant, excessive admiration. So I'm constantly needing my ego stroked. I need to be told how amazing my content is on YouTube. by all means, if you believe that, hit that like button. But how amazing I am as a therapist, as a husband, as a father, and people are constantly stroking my ego because I'm the most handsome man in the world. That would be that criteria number four. And then number five, that sense of entitlement, kind of the demands from others, expecting certain treatment and privileges because I am so amazing. And then number six is interpersonal exploitativeness. So I'm exploiting and kind of manipulating other people to my advantage. So I'm constantly just using people as pawns to get what I want in life versus building genuine relationships. So this is why relationships typically with people that have true narcissistic personality disorder really don't work very well because they're constantly gaslighting and building these people up to exploit them and use them for whatever their own personal gain is. Number seven, really big one when it comes to narcissistic personality disorder, is the lack of empathy. So just lacking to connect, really understanding people and their perspectives, or even willingness to try to understand or feel from them by any means. And then number eight is feeling envious of others. So kind of the haters gonna hate. So we're thinking other people are envious of us, or we're just envious of other people's success. And we don't do very well with that when we feel like we are being challenged or being compared to anybody else that might be doing better than us. Because once again, we have that grandiose, self-inflated confidence in ourselves. And then number nine is just being arrogant, right? So that arrogance, there's definitely a difference between confidence. I'm fairly confident in what I do versus the arrogant level. So where I'm thinking I'm just absolutely better than everybody else. So this is the nine symptoms of criteria for the diagnosis of narcissistic personality disorder. Once again, if you are ever questioning yourself or questioning anyone else, by all means, seek professional advisement for a full evaluation. The problem with just going and buying or reading the criteria based off of the DSM, the Diagnostic and Statistical Manual of Mental Disorders, is anybody can meet any criteria, right? So I definitely, when I was learning about these diagnoses, I kind of checked box like, oh my God, like I might be narcissist. Or oh my gosh, like my parents, my family, everybody I know is narcissistic, right? Which is definitely not the case. We are looking for a pervasive pattern of this behavior and meeting a certain amount of criteria. So, by all means, if you're having those questions, seek professional advisement for consultation to rule out these diagnoses. In the next video, I'm going to talk about how to differentiate narcissistic traits versus actual diagnosis criteria. Once again, anybody can meet the traits. I definitely ebb and flow with some of those traits. Sometimes I don't care. Sometimes I'm overly confident and cocky, or sometimes I do feel grandiose. As every other human being might ebb and flow through those symptoms and have some of those traits, doesn't necessarily mean that we meet criteria. So we're going to be talking about the difference between narcissistic traits, and actually meeting criteria for the diagnosis of narcissistic personality disorder. So definitely link up, subscribe to stay up to date with those weekly videos, and that way you can watch the next video when we differentiate the difference between narcissistic traits versus actually having the diagnosis.